On my videos on gastritis and acid reflux, the most commonly asked question in the comment sections were about Helicobacter pylori or H. pylori. So if you have recently been diagnosed for H. pylori infection, you are probably feeling a bit overwhelmed. Maybe you have researched a lot online and now you are even more worried or more confused. The good news is that by the end of this video, you will have the answers for the most common 6 questions that I receive from my patients who have been diagnosed with H. pylori infection. So the 6 questions that we are going to discuss today are: what exactly is H. pylori and why is it important? As the second question, we will look at how did I get H. pylori? As the third question, we'll discuss about can I spread H. pylori to my family or not? The fourth question is, can H. pylori really cause stomach cancer? The fifth question we'll discuss is about, can H. pylori be cured permanently? And the sixth and last question is, do I need to repeat another test after treatment? Okay, so let's start with the first basic question. What exactly is H. pylori? And why is it important? H. pylori or Helicobacter pylori is a type of bacteria that lives inside your stomach. Now you might be thinking, how can a bacteria survive in the stomach acid? That's actually what makes H. pylori so unique. It produces an enzyme called urease, which actually neutralizes the acids immediately around it. So this creates a tiny protective layer around the bacteria that makes them to survive where most other bacteria don't. Once it settles into the protective lining of the stomach, it can stay there for years or maybe even for decades. Now here is what surprises a lot of people. Having H. pylori doesn't automatically mean that you will have symptoms. In fact, many people carry this bacteria without ever knowing they have it. But in others, it can irritate the stomach lining and lead to problems such as gastritis, stomach ulcers, or duodenal ulcers. Over many years, if left untreated in some individuals, it can also increase the risk of stomach cancer. We'll talk more about it in the later part of the video. So if you have been diagnosed with H. pylori, don't panic. The important thing is that now you know it's there, so you can take the right steps to treat it. But that naturally leads to our second question. How did I get H. pylori infection? This is probably one of the most common questions I hear, and the answer often surprises people. Most adults didn't catch H. pylori recently. In many cases, people become infected during childhood, especially in places where bacteria is more common. It can spread from one person to other through close contact or through food or water contaminated with the bacteria, particularly in areas with poor sanitation. And because the infection often causes no symptoms for many years, it's completely possible to carry it without realizing it until you start getting symptoms. So when people ask me, where did I get it? My honest answer is, in most cases, we don't know. It doesn't necessarily mean you got it from your recent meal, your partner, or a trip you took last month. In fact, you might be probably having it for many years without knowing. And that brings us to another question people usually worry about. Can I spread H. pylori infection to my family? The short answer is yes, it can spread from person to person. Researchers believe H. pylori can be transmitted through saliva, vomit, or stool, particularly when hygiene is poor. I know that sounds worrying, but before you panic, listen to this reassuring part. Most adults have already been exposed to many of the same bacteria within their household over the years. So this is not a reason to isolate yourself from the family. Instead, focus on simple everyday habits. Wash your hands properly after using the toilet. Wash your hands before preparing or eating food. Avoid sharing utensils or toothbrushes if someone is actively unwell. These simple practices not only help to reduce the spread of H. pylori, but many other infections as well. While on this topic, another common question I always hear is, so should all my family get tested? I would say not necessarily. Routine testing for every family member is not recommended for everyone. If someone has persistent stomach symptoms or falls into a higher risk group, they should speak with their healthcare provider who can decide whether testing is appropriate. So don't assume that everyone at home needs treatment just because you are tested positive. Now let's address the question that causes more anxiety than any other. Can H. pylori really cause stomach cancer? Now consider you get diagnosed for H. pylori and you go online and search H. pylori infection. And when you see terms such as stomach cancer, naturally that can be frightening. So let's put this into perspective. Yes, long-term H. pylori infection can increase the risk of stomach cancer. But here is a part most websites don't tell you. Most people with H. pylori infection will never develop stomach cancer. Think of it this way, having H. pylori infection is a risk factor, not a guarantee. There are many things that influence whether someone eventually develops stomach cancer. These includes genetics, smoking, diet, and how long the infection has been present. Now the encouraging news is, treating H. pylori can significantly reduce the risk. One of the world's leading international guidelines on H. pylori recommends treating H. pylori because eliminating the bacteria helps prevent future complications, including gastric cancer. So instead of seeing your diagnosis as a bad news, I want you to see it as an opportunity. You have found the problem, now you can treat it. And that's one of the best things you can do for your future stomach health. Okay, that being said, let's get into question number 5. Can H. pylori be cured permanently? Yes, the answer is in most people, we can cure it permanently. When the correct treatment is taken exactly as prescribed, most people successfully get rid of the infection. One of the biggest mistakes people make is stopping their medications early just because they start to feel better. Even if your symptoms improve after a few days, that doesn't necessarily mean that all the bacteria have been eliminated. Stopping the treatments early increases the chance of some bacteria survive, making future treatments more difficult because of antibiotic resistance. So if your doctor has prescribed a treatment course, I would highly recommend you to take the medication as prescribed and complete the course. Okay, to the 6th and last question. Do I need to repeat another test after treatment? Well, the answer is yes. As I told earlier, just because your symptoms are better doesn't automatically mean that all the bacteria are gone. In fact, some people feel much better after treatment, but H. pylori is still present. On the other hand, some people may continue to have stomach discomfort even after the bacteria has been successfully eradicated because the stomach lining can take time to heal. That's why we should not rely on symptoms alone. Doctors usually recommend a follow-up test to confirm the infection has been completely eradicated. Depending on the test you're having, your doctor may also advise stopping acid-reducing medications such as proton pump inhibitors for about 2 weeks beforehand because they can affect the accuracy of the result. So don't skip this step. Think of it as confirming that the treatment has done its job. If the bacteria is still present, your doctor can advise next steps rather than assuming everything is fine. And if you're somebody who is experiencing acid reflux and want to know what to eat for it, go check this video out here and I'll see you inside.